Okay, so today we're discussing the sympathetic nervous system, parasympathetic nervous system, and anticholinergics. This is presented by me, Nathan. The other group members are Esmeralda, Amanda, Jennifer, and Julia. Okay, so we'll begin with functions of the sympathetic nervous system. So it's the fight or flight system. It's important because it prepares our body to react to stressors and any sort of threats. So, like, being chased by a wild animal, it sort of helps to have all of those functions intact. The impulses of the sympathetic nervous system come from the thoracic and lumbar of the spinal cord, which releases the norepinephrine and epinephrine, which gives you that adrenaline rush, which increases when we have a stressful situation. Initially, norepinephrine is released first, and if the stress is prolonged, then epinephrine kicks in. The alpha and beta receptors are the receptor sites that the neurotransmitters actually work on. I'm not sure if this is going to be covered by the adrenergic group or anything, so we'll just continue to talk about the alpha and beta receptors in the next slide. So we have our alpha 1 receptors. The alpha receptors, they don't work on the heart or bronchi, at least not very well. Works more on vasoconstriction, which increases your BP. Your pupils dilate to increase the amount of light in, so that way you can see better. It affects the urinary bladder, because you don't really want to be peeing while you're being chased by a wild animal. Male sexual emission, again, not really something you need to be thinking about while you're being chased. The alpha 2 receptors, those ones, they are negative feedback control of norepinephrine and moderation of insulin release. So then we have our beta receptors. So the beta 1, that increases heart rate, the conduction and contraction of the heart, and beta 2 works on bronchial dilation, decreased GI activity, and the release of glucagon. Okay, so we got the parasympathetic nervous system now, and it is the rest and digest. It's controlled by the autonomic nervous system. It's also called the craniosacral nervous system because the nerves that actually control it are found in the cranium and the sacrum. The primary neurotransmitter being used is the acetylcholine, and then the cholinergic receptors are the muscarinic receptors, which will be talked about later on. So the actual effects of the parasympathetic nervous system, you're going to have increased GI activity, so you're going to have better digestion, nutrients are being absorbed, decreased heart rate and contractility, so you're conserving energy, the heart is resting, constriction of the bronchi, so you're having increased secretions, relaxation of the GI and urinary sphincters, so that way you can actually void, pupillary constriction, so that means you have less light entering the eyes, decreases the stimulation of the retina. All these things are just going to help you to rest, relax. It's like when you're sitting there after a test and you think you did great and you're just sitting there and you're all calm. Whereas the sympathetic nervous system, that's like during the test and you should have studied more. Okay, so these are the receptor sites for the anticholinergics, and their names are a little bit they're a little bit confusing because the muscarinic, they have nothing to do with muscles. Actually, the nicotinic is the one that works at the neuromuscular junction. It's actually based on what was actually used to test the receptor sites. So the muscarinic are found in smooth muscle, GI tract, bladder, heart, sweat glands. They're responsible for pupil constriction, GI motility and secretions, increased bladder contraction, slowing of the heart rate, and these are the ones that are primarily going to be blocked by our anticholinergics. The nicotinic was tested using nicotine, of course, and it's found in the central nervous system, the adrenal medulla, the autonomic ganglia, and the neuromuscular junction. It's responsible for muscle contractions, stress reactions, and the release of norepinephrine and epinephrine. Again, the nicotinic aren't aren't really our primary source of site of action for anticholinergics. It is the muscarinic. Okay, so now we have the major actions of anticholinergics. So anticholinergics are drugs that are used to block the effects of acetylcholine, and the anticholinergics, when they block the acetylcholine at the muscarinic sites, they're blocking the effects of the parasympathetic nervous system, which is why they're also known as parasympathetic agents. The drugs competitively block the acetylcholine receptors at the muscarinic receptor sites. Some are more specific to certain areas, such as the respiratory, genitourinary, gastrointestinal tracts, and the other drugs will actually just do a generalized depression of the parasympathetic nervous system. So anticholinergics, they're thought to block the effects of acetylcholine in the central nervous system, which would be the reason for treating motion sickness. And the effects of blocking the parasympathetic nervous system, it's going to be pretty much all the effects of the sympathetic nervous system because it's taking over. So that means that you're going to have an increase in heart rate, decrease in GI activity, decrease in urinary bladder tone and function, and pupil dilation, among a multitude of other things that will be happening. So the primary uses of anticholinergics, they're used for a lot of things, at least they used to be. They were originally used to decrease GI activity and secretions to treat ulcers and allow the sympathetic nervous system to become more dominant. Today there are better drugs with less adverse effects that are the more popular choice. So, like I said, they're used for a variety of reasons other than decreasing secretions for the treatment of ulcers, and those are decreasing secretions before anesthesia, restore cardiac rate and blood pressure. That's like if they're coding, that's why you give the 0.5 of the atropine if they're alive, 1 if they're dead. It treats Parkinsonism, relieves pylospasm and hyperactive bowel. Some treat the symptoms of motion sickness. Relaxes the bladder muscles, relaxes uterine hypertonicity. Some can control rhinorrhea, prevent bronchospasm in COPD patients. Used as an ophthalmic agent to cause mydriasis, which is just dilation of the pupil. It can treat poisoning by certain mushrooms, and it's an antidote for cholinergic drugs. Okay, so moving on to the side effects of the anticholinergics. They're related to their effect of blocking the acetylcholine on the parasympathetic nervous system at the muscarinic receptors, as previously stated. This blocking of the parasympathetic nervous system makes the sympathetic nervous system dominant. Generalized side effects are complicated, and some are actually beneficial to the patient. The best way to remember the general side effects are to remember the systems that they affect and the systems they are triggering by triggering flight or fight, and what will happen. Why does it happen? Imagine you're a prey animal and think back about the evolutionary advantage. Your pulse will increase as well as your blood pressure, which can result in tachycardia and palpitations, as well as increasing intraocular pressure and generalized flushing. The pupils of the eye will dilate to allow the person to see the surrounding area, so that way they would be able to see a predator or threat. And that dilation can actually cause the blurry vision, the photophobia, and the cycloplegia, which is paralysis of the ciliary muscles. Now let's go to the GI system. You're not going to be wanting to digest food when you're running for your life or fighting. So as a result, you're going to have decreased secretions, and this allows more energy to be utilized for the immediate concern of the fight or flight. The saliva dries up, taste buds, perception changes, nausea, bloating, sometimes generalized heartburn. The bladder tone also relaxes because you don't need to be peeing while, you should be running or fighting. I mean, unless it's a defensive strategy, like when a toad pees in your hand. So, now there's a random fact. Do you know that the turkey vultures gorge on decaying material, and if interrupted during a meal, they will actually regurgitate on the predator to make their escape? Yeah, fun facts. Okay, so these are some illustrations for the side effects. There's also some more to talk about for the side effects. So does anyone get dizzy or weak before a test? Yeah? Well, that's the sympathetic nervous system. And since anticholinergics allow the sympathetic nervous system to be dominant, the patients will feel dizzy, weak, have problems sleeping, possibly have confusion, and not just because they can't remember if they should pick A or C on a test. Do you get hot and flushed? That's, again, the sympathetic nervous system, because we stop sweating and have problems cooling off. One of the good points about anticholinergics is that the severity of side effects is directly related to the dosage, which I will go into later. So these illustrations were done by Amanda, and we have blind as a bat, hot as a desert, dry as a bone, mad as a hatter, red as a beet, and then can't see, can't pee, can't spit, can't shit. These are all just ways to remember the side effects, and especially toxicity as well. Okay, contraindications and cautions. So, when do we need to be careful? Well, anything that would be exacerbated by blocking the parasympathetic nervous system, tachycardia, hypertension, because these would just increase the effect. Pre-existing conditions such as glaucoma, because you're going to be increasing the interocular pressure, BPH, bladder problems, paralytic ileus, because, you're not going to be moving anything already, and then we're decreasing it. It would just make things worse. Toxic megacolon, an obstruction, and, well, of course, allergy. So there's a caution for lactation and spasticity and brain damage. Anticholinergic effects can also be increased with certain herbal therapies such as bird rock, rosemary, and turmeric. So we're going to move on to specific drugs. So atropine. So it's typically used before surgery. It also treats Parkinsonism. It returns the heart rate to a normal post-vagal response. It's used to treat bronchospasm, biliary spasm, uterine hypertonicity, rhinorrhea, control of crying and laughing, and brain injury, mushroom poisoning, and used IV during code, which, remember, 0.5 alive, 1 if they're dead. The most common of these are the surgical, code blue, and bradycardia. They're also used as a antidote for cholinergic drugs as well. So it acts by depressing salivation, depresses bronchial secretions, it dilates the bronchi, it inhibits the vagal response, relaxes, inhibits the GI and GU tracts, and causes the ciliary paralysis in the eye and the dilation. This is the one that comes from belladonna, which back in the 1800s, women would wear around their neck to make their eyes dilate, and that was in the hopes of, getting a rich husband. And just as a side note, African Americans may require higher doses of anticholinergics and atropine, which is an anticholinergic. Atropine can be given IM, IV, sub-Q, or transdermal. Okay, now onto scopolamine. So it's used to treat motion sickness. It decreases GI secretions. In obstetrics, it's used to induce amnesia and cause relaxation. Decreases urinary problems, treats ulcers, dilation for eye exams. So along with all of the other side effects that are generally accompanying the anticholinergic, scopolamine has the added side effects of hallucinations and sedation. You know, like when Amy was talking about in class about her patient who was having hallucinations on a cruise. And again, we have a beautiful drawing from Amanda about a unicorn pooping rainbows and flying cupcakes. Scopolamine can also be given PO, sub-Q, IM, IV, ophthalmic solutions, or transdermal. Okay, and on to ipratropium bromide. So this one is used to treat bronchospasms and asthma if inhaled, seasonal rhinitis in the form of a nasal spray. The specific side effects for this one are anxiety, nervousness, headache, nausea and vomiting, upper respiratory tract infection, nasal irritation, and most things that treat bronchospasm can also cause bronchospasm. So this one is a lot less systemic for the side effects due to the fact that it is in a specific site. So you're not going to have the dry mouth, blurred vision, urinary hesitancy, constipation with the inhaled or the nasal spray. Okay, so now into the nursing considerations. So you want to assess the neurological status for CNS effects such as the sedation, hallucinations for the scopolamine, weakness, dizziness. You want to monitor cardiac functions for tachycardia, hypertension, and possible cardiac arrhythmias. You want to auscultate the lung sounds for bronchospasm. You need to assess the INO for urinary retention, auscultate for bowel sounds for possible paralytic ileus, and you want to monitor for signs of toxicity. So it occurs in this order. So you're going to have the cardiac slowing, dryness of mouth, inhibition of sweating, then definite mouth, hand, and throat dryness, thirst, tachycardia, pupil dilation. Then we start getting to the worst side effects. You have your speech disturbances, dysphagia, restlessness, fatigue, headache, dry and hot skin, urinary retention, reduced GI peristalsis. Then we're getting to this has gone far enough, this is really bad part. So weak and rapid pulse. The iris is nearly gone. You have ataxia, excitement, you have hallucinations, delirium, and coma, and eventually death. Okay, so this is the Anticholinergic song. It is to the tune of Baby Britain by Elliott Smith. I just changed the lyrics up. Anticholinergics are the best for blocking up piazza nerves. It helps to treat ulcers, but decreasing all the secretions. It's only muscarinic by competing with acetylcholine. Doesn't affect nicotinic, so there's little effect on the neuromuscular junction. It increases heart rate, decreases GI activity, decreases urinary tone and function, pupil dilation and psychophagy. Now about atropine. It's used in cults with bradycardia and low BP. 0.5 for Theralide, 1 mg for those who've already died. Relax uterine hypertonicity, treats pyelospasm and hyperactive bowel, dilates the bronchi, inhibits vagal response in the heart. It's not for people with these, glaucoma and PUD, bladder obstruction and prostatic hypertrophy, caution breastfeeding and spasticity, gives a look in your eye, dilating real wide. Anticholinergics are wide. motion sickness, it can really make you see strange things and become sedated. Then there's ipratropium bromide, used for bronchospasm and asthma, and also seasonal rhinitis. It has far less systemic effects. You have to watch out for these. Can shit, can't spit, can't pee. Oh, and they can't see. Hey, it could be anticholinergic toxicity. Okay, well, that's all, and I hope you enjoyed the lecture, slide, review, whatever you want to call it. And this is just our bibliography, so, well, good luck everyone on your exams and HASIs and everything.